We are joined by doctors Carol Drabick and John Michael Johnson, another two members of the fabulous team of Bishop Eye Associates, and we're going to be talking a little bit about dry eye today. So Dr. Drabick, can you tell us, why don't you kick it off for us and tell us a little bit about what it is and why it might be interesting to our viewers?
Well, I think it's an important topic because it's something that most of us will experience at some point in our life. As we age or accumulate birthdays, as I like to put it, just like all the other parts of the body slow down, become less functional, the same is true for those glands that produce our tear film that coat and protect the surface of the eye. So as we age, that is a system that doesn't function as well, and it can have a pretty profound effect on our ability to do the activities that we do day in and day out, and really undermine the quality of our life. The majority of a large majority of the patients that both Dr. Johnson and I see are devoted to or involved in patients who suffer from this condition, and it can run the gamut from being mildly annoying and just a nuisance to the range of being severely debilitating and painful. And if it's diagnosed and treated and managed early, then these patients tend to fare much better and can often prevent some of the serious consequences that we see with this condition.
Okay. Dr. Johnson, can you tell us a little bit about what one would experience with this condition?
Well, yeah, probably one of the biggest things that we see coming into our practice for, let's say, just like a work-in, eye exam where someone's having uncomfortable eyes, would be usually, based on a dry eye sort of diagnosis. But probably one of the biggest things we see is blurry vision. And that's what I always try to basically relay to the patients is that, before a lot of pain or irritation, sometimes dryness causes fluctuation in vision, blurriness at the end of the day, blurriness after you've been reading, or using the computer for a long time. I think everyone, you kind of think of the dry eye, the sort of, even the name of it, of course you're going to have, if you have severe dry eye, you're going to have pain in the eye or watering, redness, irritation. All those things are kind of thought of as dry eye, but I always really kind of focus on the vision relation as well, because that's sometimes the most debilitating part of it is people are having problems with vision and everyday function, and it's because of dryness, and they just don't really know that.
So Dr. Drabick, what causes dry eye?
Well, as I had alluded to, birthdays. And there's many other things that can affect it. Medications. Many of the medications that we take just to manage a lot of the common conditions that we see, high blood pressure, patients who have thyroid conditions, patients who have rheumatoid arthritis. A lot of these things will actually, autoimmune diseases will affect the production of the tear film.
One other thing, we're actually discussing, different causes and kind of trying to organize them in a way to understand maybe better. And one of the big things that really kind of underlying cause of dry eye would be inflammation in the body in general. And with age, we see increase in inflammation throughout time. Other things that cause inflammation, just as Dr. Drabick said, autoimmune diseases like thyroid conditions, Sjogren's, rheumatoid arthritis, all those underlying causes of inflammation, we've seen really inflammation in the lacrimal gland and around the eye increases dryness. And one of the big problems with that is if you think about dryness causing inflammation, it's almost like a negative feedback loop. So inflammation causes dryness, and then the more dry your eyes get, the more inflammation happens. So sometimes what we need to do is, break the cycle of inflammation.
There's some commercials on TV for Restasis. and to treat dry eye. And what is that? And do you offer it and do you recommend it?
Yes, we definitely offer it, and we frequently recommend it. Restasis is a medication called cyclosporin, and cyclosporin has been around since the 1970s to treat organ rejection. It prevents the inflammatory response that the body mounts against, if you've had a heart transplant, for example. Well, when you harness that medication and make it into an eye drop and put it topically into the eye, it reduces the inflammation that occurs in the main gland that produces our tears, the lacrimal gland. And by reducing and reversing that inflammation, the gland functions more efficiently and effectively, and it actually increases tear production. And it works probably in about 75% of those patients that have confirmed reduction in tear production.
Restasis is a great thing to think about as far as treatments, because that's probably one of the biggest things that we see, like on television, things
Sure.
like that. But even before going to a prescription medication immediately, many times I think what's really great for almost every patient, regardless of severity of dry eye, would be an artificial tear 3 times a day, warm compress every morning. That makes a huge difference. So kind of going, maybe stepping back a little bit toward like
Sure.
the treatment versions. I don't want to just be, a commercial for one thing or another as far as products or Restasis,
Right.
but really a lot of times patients would really benefit from just basically a good routine of lid hygiene and an artificial tear. I mean, I'd say, what would you say, probably a good 30 or 40% even of patients, if they were to get on a good routine of just eye lubrication,
Sure.
would be very helped.
So, I mean, somebody who would come in for an exam, for example, something is kind of going on with their eyes, they have irritation or some of the symptoms that we had discussed a little bit earlier, and walk through the process of exactly what would happen for someone.
Well, the first thing that we would do, if you haven't been to an eye doctor in a long time, we'd probably just do a regular, full, comprehensive exam just to judge the overall, health of your eyes. Dr. Drabick and I, we actually sometimes get referrals from other doctors for dry eye, and so a patient's already had that just last week, and at this point we're saying, okay, we need more a comprehensive sort of dry eye evaluation, because whatever they've been doing in the past hasn't been working, or whatever it might be. For them, we don't have to go through like from the very beginning, dilated exam and all
Sure,
that kind of
sure.
stuff.
Well, is it something, let me just ask, is it something that goes away, or is it something that you sort of, it's degenerative, or it stays with you, or?
Unfortunately, many times it's chronic. I have had
okay.
patients, and probably we've all had patients where, sometimes it seems like we treat it for a while, and all of a sudden they feel better for months and years. But almost always it's a chronic sort of nature. So even if it goes away for a while, we usually still have to maintain it and treat it.
How frequent are you seeing people with dry eye, and do they come and get the diagnosis with you?
It's one of the most prevalent, common conditions we see. So many patients don't know that's what they're suffering from. As Dr. Johnson said, a lot of them come in with blurry, fluctuating vision without the traditional, what they think of as dry eye, and many times concerned that they have something much more serious. So they're relieved to find out that they have it, but it also means that it is a chronic condition. It's something that's going to take constant work to some degree on their part. The eye drops are helpful, but there's other things like lid hygiene, lid scrubs, and warm compresses and things that make a big difference, but also are annoying and problematic, and people don't like to do them. So it takes a lot of hand-holding and cajoling.
Sure.
And working with patients to try and work out a schedule and a management plan that they can stick with and feel beneficial.
And all the more reason why they need to come in and see you all at Bishop Eye Associates. And what would be the best way for our folks to find you and to do that?
They could just call our office, and if it's specifically for dry eye, you could always ask for a dry eye evaluation. Kind of make the front desk aware that that's what you think that the problem is. me and Dr. Drabick are always more than happy to see anybody that comes in. Exactly what she said, I think that the best thing to know about dry eye is sometimes it can be chronic, sometimes it's frustrating. I will say that I think that our practice definitely has the most scientifically sort of advanced practice in treating the underlying causes of dry eye. And actually helping some people that are very frustrated if they've been to other places and they feel like they've not gotten anywhere. We're really good at basically helping them out. But really, we're happy to see them.
Dr. Drabick, tell us your web address and the best way to get in touch so folks can set up an appointment to see you all.
Our web address is bishopeye.com, and the phone number is 208-3937.
Which conveniently spells
Eyes.
eyes. Bishop Eye Associates, Drs. Drabick and John Michael Johnson. Make sure that you give them a call and set up your appointment if you're experiencing any discomfort with your eyes or just to have your annual exam.